Good evening to all of you. Thank you for this invitation to speak about mental health and coping in this time of COVID. Um, I accepted this invitation really because I can see how people are more and more aware of mental health these days. There is no health without mental health. And it's very important, especially during this extraordinary, unusual, unprecedented time that we're experiencing. I think it becomes even more imperative for us to be checking on our mental health, considering that this is a not very usual time in our lives. And we are sharing it with everyone. So, for those who believe that they are coping well, this will just be a good validation of the adaptive, healthy things that you are already doing. But for the others who might have questions in their minds, so hopefully the contents of the talk will help you and help clarify things for you. For those who enjoy movies, I think you will be familiar with this collage of movies in the past decade: Contagion, Outbreak, and Pandemic. And what we're experiencing right now is very similar to what goes on in these very exciting and thrilling movies, except that the difference is it's now real and it's happening um, right before our eyes, and we are really witnessing and we are experiencing it. And also, this time, given that most of these movies are all star casts, we are actually playing the roles of the actors and the actresses in this particular reality where we are living. And our script is no other than how we would actually live our lives. And how we choose to play these roles would actually depend on us as well. So hopefully, how you've been doing in the past, if it can still be improved, then we can do so. If there are improvements that we can further make, definitely in the days to come and the weeks to come, especially since we have heard that it has been extended again for another 2 weeks, then it's really in our hands how we will choose to live in the next couple of days and weeks that we have. Of course, with God's guidance and with God's grace. What makes this virus and the illness that comes with it very different? Whenever we get sick, we know we're usually referring to flu-like symptoms, unless, of course, there are other more serious symptoms. But the common cold or the common flu is something that all of us have experienced. It's not new to us. Usually, it's the reason that we give in the offices or at work to be excused when we have fever, low grade or even high grade, cough, colds, no, body malaise. These are symptoms that are unfamiliar or not unfamiliar to us. We can have sneezing and allergies, itchiness, a stuffy nose, no? However, contracting the coronavirus infection is quite different. We hear that it has claimed the lives of many people, and the illness, though it can have a mild presentation, it can also lead to a very severely ill individual, such that hospitalization may be necessary. And like I said, complications and sometimes, sadly, even deaths. It's not unusual in our history to actually experience pandemics like this. But I think we will all agree that in our lifetime, this is the first time that because of a contagious, highly infectious disease, that we are made to stay home under community quarantine. So I guess in a very different way. It's something that we have not experienced in the past in our lifetime. So whether you're in your 20s, in your 30s, or even in your 50s, but yet unprepared as we may be, we are, of course, compelled to cope with it just the same. What are the mental health and psychosocial issues associated with a pandemic? We can look at it in terms of these common stressors that we are experiencing as we are facing this particular pandemic. The fear of falling ill and dying. We mentioned getting sick earlier, but this is not just any ordinary sickness. It is a sickness that can make us very, very ill, and it can even lead to deaths. And sometimes facing illnesses and the dying process and death can make one feel very frightened and very scared of the thought. And then apart from that, because we know that the healthcare facilities nowadays, they could be uh, they could have patients who are admitted also for COVID-19. We tend to look at it as, oh, I wouldn't want to go there, and therefore I would even have to avoid going to a healthcare facility should I get sick, whether of COVID or of something else. So that fear in general is something that hovers around everyone, and it can be very frightful. Fear of losing one's livelihood. I think this is something that all of us universally um, have felt at some point, because there seems to be a threat and a difference as far as employment is concerned. Many of us are um, working from home. Others who, depending on the type of occupation that you have, say, for example, for me as a doctor, if we don't go to our clinic, we don't have any income. So that is different from those who have employment. But at this time, if you are asked to stay home and to work from home, then there's a big difference. But somehow you couldn't help but seem to think that there's a threat in terms of your livelihood, in terms of your receiving income. What's going to happen to me? What will it entail? Is it going to eat up on my leaves in the future, both vacation leaves and sick leaves? So this is something that faces all of those who are experiencing this particular perceived loss or even that threat to one's livelihood. Aside from that, there's this overwhelming fear of being socially excluded from other people or being placed in quarantine. Social distancing in itself is not familiar to us, because there has not been a time in our history where we were required to actually do this, to avoid large gatherings, and more so to stay at home um, indefinitely for a long period of time. And if we're counting the days, we're already doing more than 4 weeks. And with the extension to May 15, it's practically almost 2 months. As social beings, this is something that might be or might pose a stress to people. The feeling of powerlessness, no? We are fighting with something that we are not able to control. In fact, it is invisible, so we're not able to see it. And sometimes there's a scare or a threat to us not being able to protect our loved ones should they get afflicted with this condition. Even with wealthy countries like the United States and Italy, they have this feeling of powerlessness, in spite of the fact that these are considered powerful countries, because of the overwhelming nature, and the healthcare facilities are in fact, you know, up to the brim, and they're not able anymore to save lives of people, even if they want to. So this is a pervasive feeling of powerlessness that can be on and off, or it can be something that lingers for a long time. What about refusal to care for others who may have been exposed due to the fear of infection? Um, Really, the threat is that anyone can get infected. Of course, the vulnerable population are those who have the propensity to get more severely ill. But at the same time, our usual mode is that we take care of other people. But the fear of getting the infection um, oneself is something that causes the other opposite, which is not wanting to care for others, even if there's a desire or an obligation or a duty that one also wants to answer for. I remember that even in Medical City, in the past, it was part of the infectious disease section policy to not allow caregivers to take care of the hospitalized patient. However, given their experience with these patients, when they are put in isolation, they go into a lot of psychological distress, such that they have decided that it might be more beneficial to lift this particular policy and ease it up by allowing caregivers to come in. But lo and behold, it is actually found in majority of these patients that even caregivers decline the offer to accompany their patients, and vice versa. Some of the patients would realize that, it is a big sacrifice to ask these from the caregivers. So they would also allow the companions to just stay at home and they'll just try to take care of themselves. So this poses a stress both to the receiver of the care and also to the one who's also being accompanied. And this is a common stressor that we experience given this particular pandemic. There is that feeling of helplessness, boredom, loneliness, and sometimes extreme sadness due to being isolated, especially for individuals who desire to have social interactions and continued social relationship. This can be a bit of a challenge having to be isolated. So even in your own places, whether you are living alone in your apartment or in your condominium unit, or if you need to be quarantined, if ever there has been an exposure in the past, um, the this particular rule of having to be isolated can evoke feelings of sadness, feelings of not anymore knowing what to do because you have run out of things to do, and you're looking for ways to pass the time. And if alone, really, the feelings of loneliness can sink in. And this can prove to be stressful for an individual who's experiencing that. The fear also of the current situation taking a turn for the worse if the worst has not happened yet, and that uncertainty that hovers all of us because we're not quite sure of what's going to happen next. We seem to be taking things one step at a time, 1 week at a time, and then there will be adjustments that follow as a result of the evolving um, policies that we have, the evolving policies that the government imposes on us. And then, of course, the possibility that we could relive the experience of a previous pandemic. Because, like I said, this pandemic, as it is not one that is like no other. It is now 2020. I'm not sure if you recall when the last time was in your lifetime or in our lifetime that we experienced the pandemic. It's actually back in 2009. So all of us were already alive at that time, 2009. The H1N1 virus in the United States, there was an outbreak, but we know that it's not as as different as we experience this particular pandemic. One that comes closest actually to a very catastrophic type of pandemic was back in 1918, the Spanish pandemic, which is the Spanish flu, where similar situations of a lockdown were experienced, but I believe that none of us were alive in 1918. So clearly, this is unprecedented. This is the unusual, extraordinary crisis that we are experiencing at this time. And the fear can be quite gripping considering the novelty of it and the newness of this experience. Okay. So what are specific stressors related to COVID-19? The risk of being infected, of course, is one very big stressor, knowing that the spread, um, the spread is actually fast and rapid, and people who may not be exhibiting symptoms could in fact be carriers also, and therefore could be infecting others, since the mode of transmission is not 100% clear. What we do know is that it is by droplet transmission, but then more and more news these days tell us that it could be, it could also be staying in the air um, longer than we think it is. And of course, that makes it more contagious. On the other hand, common symptoms of other health problems can also be mistaken for COVID-19. The common flu, which will present with cough, colds, and can also have fever, is sometimes mistaken for it, in which case these are the ones who, after being tested, can turn out to be negative. So they are the PUIs, the persons under investigation. On the other hand, even if that is the case, they do grapple with feelings of anxiety and fear that they might have COVID-19. And apart from this, there's that exponential rise in disease rates. I think you may recall even in the first few weeks that the cases just seem to be rising and rising. We started out with less than 10, and then our rates now are very high as far as Southeast Asia is concerned. And we have more than 6,000 cases of COVID-19 in the country. And then on top of that, there are also rising death rates. If you look at this particular DOH bulletin, we see there that the deaths are 437 and the recoveries are 654. I think about 1 or 2 weeks back, the deaths are actually far more than the recovered patients, which is a bit sad when you look at that. I think this one is better now that the rates of recoveries are higher than that of the death. And what about the stressors in the community? The fact that we all have to do social distancing is in itself quite stressful, considering that this is something we're not accustomed to. Especially, how do you do social distancing in crowded places like marketplaces or in congested places, or even in a metropolis like Metro Manila? How can social distancing really be done to ensure that we do not infect other people? So this in itself, because we are not, by virtue of us not being used to it, is in itself stressful. There's also limited access to food supply. Not that there's inavailability of food supply, because it is quite available, but because the groceries would have window periods, then people would have a hard time accessing groceries and food items. And then on top of that, there are also limitations as far as bringing in food inside the city. And so this has posed really a big burden to a lot of people, especially those who are, living off day to day, and they cannot buy a lot of supply and stock up at home. So this continues to be a problem and a source of stress amongst people. There's also indefinite or temporary closure of businesses, like in stores and in restaurants. And it's indefinite because they don't know when it's going to open. The skeletal workforce in some offices have already been imposed, and that poses a burden also on those who do have to report, who continue to have to report to their offices when the others are working from home. And even in the hospitals, when there is, because some people have to be quarantined, then there is a skeletal workforce that is also imposed, and it gives some burden to those who continue to report for work. There's limited transportation. We know that public transportation has ceased, and therefore those who continue to be mobile and those who continue to still have to report to work may have difficulties even getting to their destination. Travel bans have also been imposed in certain countries. Um, for one, uh, those who need to leave already going to the provinces or going to other countries because of the travel restrictions, then this is something that becomes a burden even to those who have to leave already. What about students? They have concerns about their education and if they are going to get promoted, how are they going to learn? And these are all stressful. So even for people from different walks of life, this continues to be a concern. Of course, checkpoints here and there, curfews being raised, and also the inevitability sometimes of crimes happening within the city and the fear of having to become victims to those crimes. So overall, we we are expecting that there's a deterioration of economies because of what is happening to the businesses. Social networks are likewise deteriorating. And the local dynamics, what we have been used to, the local autonomy of even some local government units, it's not working very well. And sometimes we would have to rely on others for support. Say, for example, the testing kits or the medical supplies that have to be brought into the country. So this really shows how there is the deterioration of that former stability that we used to have as a nation. There's also stigma towards surviving patients in that if they have recovered, no, they are usually marked as COVID positive patients. No, it's actually they're supposed to be patients who have contracted COVID or have recovered from COVID, but somehow there's a label to them, and especially if they are included in the statistics, then they become numbers and they face a lot of stigma from people who know that they have contracted the illness, and so sometimes they get rejected, they get ostracized. There's also possible higher emotional state, anger, aggression, and unrest among citizens, no? Against government if they disagree with how the government is running um, uh, the country. And also sometimes they ostracize against frontline workers because the frontline workers are uh, people who are at risk of actually being positive themselves and exposing others to it. So this is something that we see in the community these days, and it poses a lot of stress within the community. What about the handling of information? We have heard even in the beginning that a lot of our politicians got the brunt when they were using the test kits and trying to prioritize themselves and their families, whereas a lot of patients with symptoms were lining up to get themselves tested. So there's a lot of mistrust going on as far as information giving. Of course, my picture here is the president of another country, but even our own president has actually raised eyebrows among people because of comments perhaps that he very informally or casually drops during the meetings. And to a certain extent, This can cause others to not trust the government and to be able to see or not see that they are stepping up in times of this crisis. There's also a possible increase of family and intimate partner violence. You may have heard in the beginning that divorce rates were going up as a result of the community quarantine. But the reality there is that because of the stress experienced within the family and the stress experienced within the community and the needs of the family, um, violence can actually take place in the homes. So this again poses a type of stressor. And lastly, of course, the risk of increase of relapse or negative outcomes among people with other medical conditions because they would avoid healthcare facilities. So even those who have, let's say, serious conditions like stroke or heart diseases, um, when they fear going to the hospitals, in fact, even their medical emergencies can cause them to um, to have problems because they would stay in their homes instead of already go to the emergency room settings. So how do we respond to this particular problem because of these multiple stressors? Then crisis in fact occurs because the adversities and the adverse experience are now affecting each and every one of our lives. And with this crisis, which we consider apart from the normal, what is considered a normal reaction to an otherwise abnormal situation? Okay. Some of these fears and reactions actually spring from realistic dangers. We really are exposed and we could be at risk for getting the infection, which could be a realistic danger. But sometimes there are many reactions and behaviors too that are born out of a lack of knowledge or because of false rumors or because of misinformation. And this brings about, for example, panic buying, behaviors like hoarding, or avoiding healthcare facilities even when really needed. So this is something that we will iron out as we discuss further how better to cope. What are the range of emotional reactions that we can experience as a response to the crisis that we are facing today? It's okay to not feel okay. So I think it's very important to highlight that. It doesn't have to be a positive feeling all the time. And so if you're experiencing fear because of the stressors that have been named earlier, you are experiencing anxiety, you are getting stressed, or you are mad at the situation, or if you are feeling guilty because you want to help but you're not able to help, or you're feeling guilty because you're not able to take care of a loved one, if you're experiencing sadness because of the depressing news all around us, or if you're experiencing sadness because you have actually lost a loved one, then this is a feeling that is within normal. Other times, we would avoid other people as well for fear of, is this a potential PUI or is this person an asymptomatic carrier? And so you'd rather just avoid the individual. Or sometimes there could be wanting to be in denial. I remember this friend of mine was sharing that the mom, who's actually a senior citizen in her 70s, was still insisting on going to the grocery as if nothing had happened. So this is also a coping mechanism of some individuals because they don't want to face the reality because it is way too distressing for them. And some may be experiencing shame because If, let's say, they have been exposed to people uh, who have had the illness, or let's say if they have family members who have had COVID too. So this range of emotions, no, feeling anxious because of the uncertainty, feeling anxious because of the unusual situation that we're all in, is experienced universally by a lot of people. And again, we want to emphasize that it is okay to not feel okay. How then do we promote one's well-being in the face of this COVID situation? I'd like you to look at this slide on self-soothing, because this is one of the ways to reduce the degree or the intensity of our negative emotions. And it makes use of the 5 different senses. You can go ahead and try to see what suits you. You don't have to try all of them. But if you are more of a visual person, then you can self-soothe by sight, low lighting, dim lighting, calming to the eyes, soothing colors, wearing of eye masks, using coloring books to de-stress, and use collages of pictures. If you are more the tactile type, no, that is the touch, then you can soothe yourself by touching soft things, and you can cuddle pillows, or you can have, let's say, a significant other give you a massage, no? A hot and cold shower, or even a comfortable heating or heated blanket to keep you warm. There are also sounds that can be soothing. Um, there can be calming noise, or you can tune in to even music from your gadgets. You can tune into Spotify. ASMR is autonomous sensory meridian response. It's a kind of relaxing, sedating sensation which radiates from the scalp down to the body. And there's like brain massage. And so it is soothing, it is very relaxing. There are also guided meditations and sounds of nature. You can just search in the net, and you can find a lot of these apps. There's the Calm app, and there's a mindful meditation app. There are also binaural beats, where this is combining 2 beats of slightly different frequencies that merge into one in a soothing, calming sound. And this is used by many to relax themselves so that they can have a good night's rest and to be able to induce sleep at night in a relaxed state. For others, it could be aromatherapy, or smelling fresh air, or smelling incense or candles, which are also relaxing, like lavender or eucalyptus. And then for others, um, we get comforted by food, so the palate. Um, Strong flavors like hot chocolate, or even turmeric tea. And these warm drinks are meant to soothe one's palate. And this is something that can decrease the level of negative emotions. We are also encouraged to eat slowly and to relish the taste of the food that we are eating. And also, there are flavors in the past that we can look back on and to like relive them by preparing the same kind of food and enjoying how they taste. Another way is actually to reframe the way we think as far as self-isolation is concerned. I heard from the others that some may be living on their own, and so it's really very difficult when you are looking and staring at the 4 walls of your room, or if you just need to go to the kitchen, which is just a few steps away, or the bathroom. And self-isolation can really be very confining. So thoughts like, My friends and I can't see each other. So these are automatic negative thoughts that can fill one's mind. And yet we could reframe and put it in another perspective by saying, my friends and I are protecting each other by staying home and being apart from each other. So rather than saying I'm stuck at home, it could be I am safe at home, or I have lost all of my freedom. I have relinquished my freedom for a noble purpose. So it gives you that positive perspective in terms of how you're looking at the current situation. Let's say I miss the things that I love. Instead of saying that, then I'm increasing my gratitude for the things that I love. So this is reframing our negative thoughts so that it becomes framed in a positive, still objective, logical, and rational way. Okay? Of course, the best antidote to isolation is staying connected with other people. So that is, of course, my women's group and us having our Ouija meetings. So continuing to connect with others, your group members, people in your office, and then your family members, whether they are, let's say, living elsewhere away from home, then you can communicate with them through technology. Of course, with the people at home, if you're experiencing fear or anxiety, you can always talk or vent to somebody who you trust can help you. And we know that it is therapeutic because even just talking to someone is already a relief of the burden that you are carrying in itself and is considered therapeutic. Now, it's very important that while you are staying at home or working from home, that you establish a daily routine. So it's important to eat a balanced diet and to eat regularly. And if you have other people to eat with you, that hopefully you spend this time together to eat together as a family. Exercising regularly and doing physical activities is also highly encouraged. And scheduling work at home is also very important, that you start the beginning of the day as you wake up, after breakfast, and then if you want to do some exercise, and then you allow like a chunk of time in the morning and again in the afternoon if you need to work from home, so that it doesn't overwhelm you, because sometimes you also it overlaps with other duties and responsibilities like going to the grocery or going to the drugstore to buy medicine and food for the people at home. And this time around, instead of the concept that there is actually rest because of work from home, sometimes it becomes overwhelming because there are many responsibilities, there are many tasks that need to be done all at the same day. So it's very important that you try a variety of activities and also to incorporate relaxing activities, listening to music, reading books, maybe coloring or drawing if you like artwork, or doing crafts. And then, of course, getting enough rest and sleep. I cannot underscore the importance of adequate sleep these days. And that means trying to protect your sleep at night by also restricting daytime sleep. It's very tempting sometimes to take naps during the day, but if you have had enough sleep at night, it's actually better not to sleep during the day, because if you sleep longer than 20 to 30 minutes during the day, what happens is that it will encroach on your sleep at night and you will have difficulty sleeping at night. And so this now has a domino effect in that you will be sleeping at irregular hours during the day because you would be snatching pockets of sleep instead of compressing your sleep at night. It's very important to try to protect this nighttime sleep. and to keep your activities during the day and to keep yourself physically active during the day as well. As part of the daily routine, of course, it's very important to emphasize that we would like to reserve and protect time to be able to pray, to be able to commune with God, and to be able to ask Him what is His message to us during this crisis. I think going through this experience will um, defeat its purpose if we're not able to see after all of this what has happened and how it has actually transformed us. We can reflect on the meaning of this pandemic in our lives and how we can respond to the call, which is to be a light in this time of darkness. What is this trying to tell us? What is this a reminder of in our lives? What is essential to us in our lives? And it's very important for us to protect this time of communicating with God, especially as we go through the busyness of the day. What makes this also special is that we can have special bonding moments with our family and with loved ones if you happen to be living with your loved ones. I remember that during the Holy Week and all of Lenten season, and of course even afterwards during Easter, um, it it gave us an opportunity to actually listen to the talks in Ligaya, to attend the Triduum uh, masses, and from Holy Thursday leading up to Easter Vigil Mass, all in the same room with our family members. And it has allowed us to actually spend quality time with them. So we want to take advantage of this time at home to be able to do that. We need to focus on what we can do, especially these days when so many things are going on at the same time. It's very important to listen to our bodily signals. What is it trying to tell us? And I think it goes back to staying connected with your emotions, because your emotions will be connected to your energy level. And if you need to rest because you are already getting too tired because of mental fatigue from all the work that you are doing, even if it is from home, that you need to listen to what your body is telling you. If it's telling you to rest, then you need to pause and to take a break and to stop. On the other hand, if you are feeling at peace and would like to continue to do your work, then again, it's a signal for you to move along with your activities. Use the skills that you have learned and used in the past in order to cope with this current crisis. If you had been a good planner, if you had organized your activities, created a schedule, in spite of the fact that you had multiple tasks, then try to do it in such a way that you are able to achieve the goals that you have set for the day. Say, for example, we because we are staying from home, we make sure that we have enough cash on hand if we need to buy things, or we could order online food or groceries or even medicine, or if we need to go there ourselves because these are acceptable trips outside, then we could reserve that time in the day so that we'll be able to do so on top of the usual things that we're able to do. So scheduling is very important for us to be able to organize our activities for the day. Preparing for the future and how we keep ourselves safe. We know that down the line after this particular ECQ, we need to ensure that when we do go outside, that we are well protected. So we need to make sure that we have masks available, and that we continue to do social distancing, and that we practice hand hygiene. So these are things that we have to be mindful of in preparation when we go out, because we know that staying at home is in fact our safety net. We can reach out to others knowing that many people out there need help. The frontliners need support. The hospital facilities need donations for PPEs and for masks. And people who are working, um, continue to working at this time also need food because for them it's also very difficult to access food. So we try as much as possible, if we can, to give support and also to receive support ourselves if necessary. We need to keep ourselves well informed, knowing updates and information, in fact, minimize fear. I mentioned earlier that a lot of these reactions that people might have is because of misinformation or rumors or not having the facts straight. So choose when to update yourself. You can give yourself a news time limit for the day. I remember during the first few weeks of COVID, when this outbreak happened, that people were just tuned in all the time to the news, such that it has already overwhelmed it could overwhelm the individual. So what you can do is just try to reserve time or protect time so that you can tune in, and then make sure that you get this information from trusted sources. The DOH, for example, or WHO, or the Center for Disease Control and Prevention. These are sites or reliable sources of information. And with this information, allow yourselves to plan well for the days to come. So always remember that because technology is within your reach, think before you click. um, the last thing we would like is to react to what is considered fake news. It also helps to actually shift perspectives. It's very important these days because when you hear a lot of negative things going on, that we want to amplify the positive voices. We want to hear um, good stories or success stories or good images of patients who have survived COVID-19. And there are plenty around. So instead of sometimes getting an overwhelming load of negative news, try to see how you could, this time around, look for positive news. And so you can also move away from the number of deaths towards the number of recoveries, because looking at the number of deaths can be very depressing, whereas seeing that more and more people recover from the condition can be uplifting, and we can look at it with more optimism. So we also hear many stories of heroic frontline workers, good Samaritans, and those who serve the public, and that they continue to serve in spite of the hardships that they are experiencing. And these are very good stories to listen to. I remember even in one of the Viber threads that I have, that they were talking about buying stuff from the groceries, and they saw that this um, elderly man had very little to put in his cart. And what they did was, instead of just letting him line up, what they did was all of them asked what he needed, and then they all started putting things in his cart, such that afterwards, it really put a smile on this man's face, because he was just intending to buy the supply for the day, and so many people tried to help him. So giving support to others, and boosting morale, let's say, of frontliners who we know are there, fighting the infection, going on 24, even 3-day shifts, to be able to save the lives of these people who have contracted the condition. And we want to focus on these and to spread hope and inspiration to a lot of people. So as we said, because it is okay to not feel okay, we have to deal with our emotions in a healthy manner, not to block them, not to dismiss them, nor to repress them, but actually to acknowledge them and to validate that these feelings are in fact normal. But if you do feel overwhelmed, it's all right actually to talk to a counselor or a healthcare specialist or a mental health professional who can be willing to help. Um, so you can have a plan, know where to go, and how to seek help for both physical and mental health needs if it is necessary. So for one, um, I can be reached and then I can help you access, because if you don't know where the services are, then we can actually refer you to where you can avail of these services. Now I put in, I know this is singles district, but I put in this portion for promoting psychosocial well-being for children. For those who do have families also, or if you have nephews and nieces at home, or if you happen to have children at home with you, even if they are not yours, it applies. Children also have reactions to what's going on around them. So sometimes they may cry or have crying tantrums. They may seek more attention or be demanding of caregivers. They're also wondering what's going on and why um, what used to happen is not happening anymore, or they used to go to school, but why do they have to stay at home? So they may also have a lot of these feelings, and we need to respond to them in a supportive and in a gentle way. So it's important that we try to allow them to express their feelings also in words, by communicating with them, by reaching out to them and asking how they feel. So if they throw, let's say, a crying tantrum, they must be feeling um, something inside that we need to facilitate its expression. Are they feeling sad? Are they worried? Are they also afraid of what's going on? What have they heard? What did they hear from the news? We can explore how the children are feeling with the way that they are acting by putting them in words. As much as possible, we want to avoid separating children from their caregivers. But if it's not possible, then we allow them to contact each other. In the hospital, we're actually taking care of nurses who are manning the intensive care units, and some of them also have families, and they go on 3-day duties, and then after the 3-day duty, that's the only time that they can go home. And when they do get to go home, they can't even hug their children because they have to put themselves on a temporary quarantine. So this is something that can be stressful, even for parents, fathers or mothers, who work and need to be separated from their children. So allowing them to maintain contact, of course, by using our electronic devices is going to be very helpful, so that communication is not stunted. So we can discuss the facts with them in words that they can understand, age appropriate words, tell them what's going on, and that the reason for people staying at home is because if they go out, then there is a possibility that if a person has the infection, then they could get sick. And we don't want them to get sick, which is why they're staying at home. And of course, when we ease later on to going out, you have to discuss again how the precautions still have to be in place, so that they understand that by going out, it doesn't automatically mean that they will get infected. So in the same way adults have to maintain a routine, so do children have to maintain a routine. We want them to incorporate their learning activities, to try to stick as much as possible to the same routine as before, except for some changes. So if they wake up at a certain time, take their breakfast, bathe before they go to school, the ones which can still happen, you try to keep those activities within the routine. And then for the time that they spend in school, make them go to a certain area at home where they could do some homework and do some learning activities. And then you can incorporate a variety of activities like exercise and entertainment, and it can be a lot of fun. They also need to manage their exposure to news and other media, which to them, if they watch TV, they can also pick up these things, and children are quick to pick up. So it's important that we know what they are listening to and to facilitate if they have any questions that we can explain to them and discuss it with them. Lastly, our children really take cues from us adults. They observe how we are. And so if you are experiencing a lot of anxiety, you need to learn to manage your emotions as well, because it's very easy for the children to pick up on these emotional cues. And the best way that we could show them how we are going to face this particular crisis is, of course, to try ourselves to be calm by managing our emotions and modeling this to them. And by teaching them the things and the safety precautions, we can do this in a manner which is appealing to them. And by explaining to them, they understand why what they're doing is essential for them to keep themselves well and healthy. So it's very important to manage our emotions in front of the children. So just as a recap, it's very important to remember that it's okay to not be okay, that you are actually not alone, because all of us are experiencing this same community quarantine that puts some of us in isolation and puts some of us in a state of where we have to be at home, which is something that we are not accustomed to. You may feel helpless, but remember that you can always ask for help. And there are things that you can do to empower yourself not to continue feeling helpless. Focus on what you can do. And remember that this is everyone's fight. So even if we are apart, we are actually all in this together. And remember that we heal as one, as a family, as a community, as a country, and as a world. We are experiencing the same thing, and we want to victor after this pandemic crisis is over, that we are stronger as individuals, that we are also stronger as a community, and that we are able to see how it is to be resilient in the face of crisis. And hopefully that after this, we will know what our purpose and our meaning is, and what happened did not happen without a reason. And then lastly, I would just like to leave you with this. It is from the letter of St. Paul to the Philippians. Do not be anxious about anything, but in every situation, by prayer and petition with thanksgiving, present your requests to God, and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Because we know that the world is actually in the palm of God's hands. He is in charge, He is controlled, and we can always surrender ourselves to Him, and He will always be there for us. With this, thank you very much, brothers and sisters.